How are you going to let me know when you're started?
It's rolling, okay.
It's rolling, okay. Hello, my name is Dr. Ron Fox, and I'm an adjunct faculty member at the California School of Professional Psychology of Alliant University. And I've been teaching in the Alliant International University LGBT certificate program. I'm a member of the LGBT community, and I've been involved in the community for the last 25 years, doing research, writing, teaching, training, therapy, and advocacy regarding LGBT issues, and in particular about bisexual issues. Today, I'm going to give an introduction to the concepts and issues that are important to know to provide effective mental health services to bisexual people. This information will help you in terms of developing greater professional competence in working with bisexual issues and bisexual people. The topics that we're going to talk about today are bisexuality, a definition, bisexuality in social context, attitudes towards bisexuality, homophobia and biphobia, bisexuality in relationships, bisexual health issues, and cultural competence and mental health services. Stop? Okay, just want to take a little break here. And get something to drink. So how was that? Was that too fast?
No, that was good. It looked good, everyone? Yeah. Yeah, it was...
Let's start with a definition of bisexuality. There are many definitions, because it's a very complex phenomenon, but this is one that I particularly like that was in the report of the San Francisco Human Rights Commission on bisexuality. And so here's the definition. An individual whose enduring physical, romantic, emotional, and or spiritual attraction is to people of more than one sex or gender. Stop. Let's see. I'm trying to figure out how to do this. See the next one? No, go back. Okay. This definition, are you on or not? Yeah. This definition that I provided is one that's evolved over time. Most of you may have heard of Kinsey and the Kinsey report and the 7-point Kinsey type scale that was used in his research on human sexuality and sexual orientation. After Kinsey, Kinsey's work was very important. At the same time, sexuality has been viewed in a dichotomous way in any case, even since that time. In the 1980s, Fritz Klein developed what's called the Klein Sexual Orientation Grid, which expands on the Kinsey scale in its core dimensions of sexual attraction, sexual behavior, and sexual fantasies by adding emotional preference, social preference, lifestyle, and self-identification. These 7 core dimensions are used, plus looking at the individual's experiences in the past, present, and ideal. These 21 points give a much more complex and accurate picture of people in terms of their sexuality. As I was mentioned just a moment ago, for quite some time, sexual orientation has been looked at in a dichotomous fashion. Gay and straight. Before that, it was stop. Can that one. Now I'm going to talk a little bit about attitudes towards bisexuality. Now I'm going to talk about attitudes toward bisexuality. For such a long time, sexuality has been looked at in a dichotomous way, polarizing heterosexuality and homosexuality. From this come some of the stereotypes about bisexuality, and along with that, some of the invisibility, prejudice, and discrimination that bisexual people experience. I'd like to go through some of the stereotypes about bisexuality, just because I think that you may have heard most of these, and these, in fact, are very similar to the stereotypes that have traditionally been held in regarding gay men and lesbians as well. So, for example, bisexuals don't exist, they're in denial, they're lying, they're in transition, they're immature, bisexuality is pathological, bisexual people are untrustworthy, unfaithful, and promiscuous, and carriers of STDs and STIs. Why is it important to look at the stereotypes? Because just as with gay men and lesbians, the prevailing stereotypes and attitudes towards sexual orientation are internalized by bisexual people. So we have biphobia. Biphobia can be looked at as the fear or hatred of bisexuals, sometimes manifesting in discrimination, isolation, harassment, or violence. Often, biphobia is based on inaccurate stereotypes like the ones that I just described, including associations with infidelity, promiscuity, transmission of sexually transmitted diseases. I'll say that again. Often, biphobia is based on inaccurate stereotypes, including associations with infidelity, promiscuity, and transmission of sexually transmitted diseases. This corresponds with some of the stereotypes that I mentioned there. And this definition of biphobia is also one that comes from the San Francisco Human Rights Commission report on bisexuality. Stop for a second. Internalized biphobia is similar in some ways to internalized homophobia. As with homophobia, the dominant cultural attitudes, stereotypes, and values about sexual orientation and gender identity are internalized based on dichotomous models of sexual orientation and gender identity. I'd like to look for a moment at some models of bisexual identity. These are important along with the concepts that I've just been talking about in order to be better able to provide mental health services to bisexual people. Bisexuality was looked at in early psychological theory as an example of arrested development. Also later, and at that time, was looked at as deviant behavior. And more recently, it's been looked at as a transitional stage towards a lesbian gay identity. Since that time, in the 70s and 80s, there have been some models of bisexual identity development that have come about. Two of the most well-known are that of Weinberg, Williams, and Pryor, and of Mary Bradford. In the Weinberg, Williams, and Pryor model of bisexual identity development, there are 4 stages. First is initial confusion, then comes finding and applying the label, then settling into the identity, and continued uncertainty. This was a model that Weinberg, Williams, and Pryor developed in the late 80s and early 90s. And you'll notice that the last stage is continued uncertainty. This is what they found in terms of the people that they interviewed, but this is also more characteristic of the times that they did their research. Mary Bradford did some research on bisexual identity in the beginning of 2000, and Mary Bradford did some research on bisexual identity development, and her research was done in about the year 2000. Her model is a little bit different. She also has 4 stages, but listen to the difference between how she framed this and how Weinberg, Williams, and Pryor's did. In Mary Bradford's model, the first stage is questioning one's own reality. In Mary Bradford's model, the first stage is questioning one's own reality. Then comes invent. Start on that. In Mary Bradford's model, the first stage is questioning one's own reality, followed by inventing one's own identity, then maintaining that identity, and finally transforming adversity. This is a very different conceptualization of what's involved in identity development for bisexual people than what Weinberg, Williams, and Pryor had developed in their own model. This is a different way of looking at bisexual identity development than that developed by... This is a different way of looking at bisexual identity development than Weinberg, Williams, and Pryor's model. Okay. Let's see what comes next here. Okay, go back then.
You're doing good at going back and forth between the looking at the screen and then looking at
Oh, I am.
So maybe, but a little bit more though, maybe.
Well, of course.
But I know it's hard because everything's up there that you need to read and
Yeah,
bullet
that's
points
true.
or whatever. Yeah.
Yeah, I feel like I'm going shh.
Does it look like, Edward, that you can tell a lot that he's looking back and forth? A little bit, yeah, okay. But it's not like he's completely... No, okay.
The reason that I've talked a little bit about bisexual identity development is that, as with lesbians and gay men, there is research on the mental health effects of minority stress. There are research findings on mental health effects of minority status. This is conceptualized as minority stress effects. One of the things that's happened often in research on sexual orientation and on research on homosexuality and bisexuality is that participants who are bisexual have been combined with participants who are lesbian, gay, in the analysis of the data and presented together. This has caused a conflation of the findings on bisexuals, and up until recently it's been hard to separate out, in looking at that kind of research, what is particular to bisexual people and what is particular to lesbians and gay men. There's more current research, however, and in this research, let's go back a step here. In the research that has been done, it has been found that lesbian, gay, and bisexual people have a greater incidence of what are called minority stress factors, and these are characteristics like anxiety. Examples of these are anxiety, depression, substance use, and HIV risk. In the more current research that's separated out bisexuals from lesbians and gay men, what we find is that there's a greater incidence of minority stress factors, even more so for bisexuals. This is important to know for the therapist because bisexual people coming for, let's start that again. As you might imagine, this is something that would be helpful for the therapist to know in terms of being prepared to work with bisexual people. Not only is there the kind of stress that lesbians and gay men feel from being a minority, but there's an additional amount of stress that comes from being bisexual and from people's attitudes towards bisexuality as it manifests in how they relate to bi people. Now I'd like to talk a little bit about multicultural issues and bisexuality. If you can imagine the kind of stress that lesbians and gay men and bisexual people experience, and you add on top of this the stress of being a racial, ethnic, and you add on top of this the additional minority stress of being a racial or ethnic minority, or being a woman, or being younger or older, or being of a social economic status that is less advantaged, or being disabled. Then you can imagine that there's an additional amount of stress for bisexual people in these categories as well. Not exactly what I wanted to say, but it's all right.
We can redo it if you want.
It's a hard one to really talk about in the first place.
Mm-hmm.
Yeah.
So it's up to you if you want to.
Let me do this because I'm almost done actually,
Okay.
and I shouldn't be, but I am, because it's certainly not an hour. It's probably not even 15 minutes, but.
Yeah, we can go back and reshoot anything.
I think that they're okay. I think the last one could be done again, but I'd like to say this first, and then
sure.
and then kind of see about going back to it.
Okay.
So we've talked today. For example. We've talked today. No, not by putting my hand on my nose. We've talked today about definitions of bisexuality, about attitudes towards bisexuality. No, that's not good. Keep your hands away from the nose. We've talked today about definition of bisexuality and biphobia. We've also talked about attitudes towards bisexuality and how this relates to mental health effects, minority stress effects for bisexuals. And all of this relates to what we want to call culturally competent practice. Culturally competent practice is important for any clients and also for working with bisexual clients. This involves looking at sexual orientation as a multidimensional construct rather than a dichotomous construct. It involves acknowledging bisexuality as a valid sexual orientation. It also involves looking at This also involves looking at bisexuality as normal rather than pathological. This also involves looking at bisexuality as normal rather than pathological or transitional. In addition, there are bisexual health issues related to both individual and contextual factors, and an understanding of the health impacts of minority stress on bisexuals is also very important to be aware of in working with Also very important to be aware of in working with bisexuals. A bisexual affirmative therapeutic approach is also essential, rather than reinforcing the social... A bisexual affirmative therapeutic approach is also very important, rather than reinforcing the societal attitudes and stereotypes towards bisexual people. All this leads to... How do I say that? In addition to what it is that we're talking about today, you might want to consider... No, I don't like that either. Further education in LGBT affirmative approaches and in affirmative approaches with bisexual... Further education and training in LGBT affirmative approaches and in affirmative approaches in working with bisexual people in particular will be very helpful to you in working with this population. That's enough. Okay. Oh, yeah, right. I just want to thank you for your interest in developing greater awareness about bisexual issues in counseling and psychotherapy. And I'm sure that what it is that you've learned today will be helpful for you in working with this group of people. And I'm also sure that what you've learned today will be helpful for you in working with this population. So let's go back to that slide about... yeah.
That was that one?
No, it's the next one.
This one?
Mm-hmm. Okay. I'd like to talk a little bit about multicultural issues in bisexuality. Multicultural issues are broadly defined as including race, ethnicity, and culture, gender, age, socioeconomic status, disability, sexual orientation and gender identity, and religion and spirituality. Just as is the case for lesbians and gay men who are... That's not quite right. The first part was fine. Individuals who are lesbian, gay, or bisexual, and who also have a minority status in regards to race, ethnicity, and culture, gender, age, sex. Individuals who are lesbian, gay, or bisexual, who have a minority status already on account of their sexual orientation, and a minority status in regards to the multicultural factors that I just described, have an additional amount of stress. How do I say that? Do I have to go back to the beginning of the sentence, or can I start in the middle of the sentence?
Maybe start over again. Just, yeah.
Okay.
That'll be better.
Individuals who already have a minority status in terms of their sexual orientation, and also have a minority status in terms of multicultural factors that I described, have an additional amount of stress impact in terms of their mental health. Individuals who already have a minority status on account of their sexual orientation, and also have a minority status in regards to the multicultural factors that I described, are likely to have a compounded stress impacts in terms of mental health issues. Okay, stop there. These are based on external and internalized dominant culture discourses regarding these factors. I don't really know what else to do with it at the moment.
Okay.
So I think maybe to look at it when it's being edited and to see if somebody wants me to come back and to say something more.
Okay. Yeah, and we can redo it again if you want, but if you think that's probably the best.
It's about as much as I'm going to be able to get today because I'm starting to get a little fuzzy.
Yeah, definitely. I understand
Which
that.
happens.
Mm-hmm.
And as I said, I know it's not anywhere near the amount of time. It just
Yeah,
isn't.
which is fine though, because we have a lot of other material.
It's going to be short, but it will.
Okay, and then maybe yeah, just say what you're like. Introduce it a little bit, like the.
Oh, yeah. I'd like to just say a few words about bisexual relationships and families. First of all, there's a wide range of kinds of relationships amongst bisexual people, just as there is amongst the larger population. Just as there is amongst the larger population. That's point one. And there are differences in terms of relationship status and kinds of relationships. And there are differences in terms of relationship status and structure of relationships. That's part one. And there are individual, contextual, multicultural, and minority stress factors that are all involved in relationship issues that bisexual people might bring to that bisexual people might bring with them to therapy. That's about it.
Yeah.
And I know you'll have, it's kind of